their reactions and what they
Yeah.
said. I was like, God, these are doctors working together. And it wasn't only with you. You would have another doctor speaking about his or her practice and what they've seen with their patients. And the other doctors are like, and I'm thinking, come on, guys, show some respect here. We're all learning, and you're sharing your what you have seen, and what you've seen has worked in your own personal practice. Doesn't mean that it works for everybody, but you're saying, hey, I've seen this work, and this is what I use. You know, if it can help and save one person, why not share that? But anyway, appetite. It worked with my family.
Yeah.
We
Well,
didn't know we didn't know the medical benefits in, and so why does CBD or cannabis, THC, and the other cannabinoids help with appetite?
primarily by stimulating the appetite center in the brain. It's mainly a direct effect. But the THCA, CBDA, definitely are having very powerful effects. But THC will stimulate the appetite. Also CBD through its anti-anxiety issues, anxiolytic things. If we get anxious, we get a little sick to our stomach, all of us. If we get really agitated, we just can't eat. Well, the CBD part tends to really help tremendously with the agitation. So then that's one more way where the appetite is increased. So you have THC working in direct appetite stimulant. You have THCA and CBDA being powerful anti-nausea, and you have CBD that's calming people, which also helps the meat.
What is the best for a cancer patient, and what work? Because we have a lot of cancer patients. We're on the top of a cancer right now. What would you recommend for one of your patients that may be going through cancer? Would you say take it? Because you hear a lot of cancer patients saying, this is one of our dear friends. She recently passed. My mom's best friend actually, but she was finding success with, an edible, because she had never been a smoker. She's wanted an edible, and it helped with the nausea. It did help with the pain, and help with appetite. And so, do you recommend an edible versus a tincture versus a vaporization of smoking?
Primarily, I recommend extracts, which are tinctures. Extracts, capsules, transdermal. To me, I get the fact that people love edibles, but from a doctor's perspective, I would much, much, much rather see somebody, here, let me grab my capsule, take a capsule, and an hour later have a Sara Lee brownie. It'd be way more tasty, be healthier than it's not the people who are baking these things are not, scientists, to say the least. And also the heat, not so much for the candies, but for all the baked goods. You maybe decarb your THC before you bake them, but while you're baking them for the 35, 40 minutes, you're subjecting every cannabinoid to 350 degrees, which totally changes everything. And that's why it's so much heavier and so much more sedating, because there's a lot of oxidation of cannabis products.
Years ago, I want to say like 2011, it may have been you talking about, about edibles. And it's like, listen, if you want an edible, just get what you want to eat and pour your dose
Right.
onto that brownie, cookie, yogurt, whatever it is, and eat it that way. And what you have here. This has been tested. You know this because you've eaten it numerous times. If it's a cracker, if it's an Oreo, if whatever,
Right.
just add your normal dose onto that and eat it that way, and enjoy them both. You know what's happening.
Yeah. I got into a thing buying those chocolate covered cherries that have maraschino cherries, and injecting in a little tiny bit of the oil that was dosed. Or chocolate truffles works well. Something where you can put the medicine in after it's baked or cooked. Truffles were the best. They were great. And this was not part of any business. This was part of an afternoon of fun. How could that not be fun?
Research and development, we'll put under that, huh?
R&D.
R&D is right. Hi, John Malanca here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at UPatients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.